Like I perform 4 appendicectomy in a day, but one of the patient gets infected. That is not in my hand. Of course, it's in my hand. Now, you have to, like you see a patient, just I'm telling you, um, day before yesterday, I operated on a lady with a huge ovarian cyst, and that contained more than 16 liters of serosanguinous fluid, pus like thing. And main thing, it's like if I weighed the lady before operation, and after operation we have not made a stand because just today is the third day. Third day means 48 hours hoini. Now, what I want to say, the audit with that patient was refused by many people. Even they did not say that you go to this place or that place. They did not guide. Then in this village, actually it's in the Jharkhand and Bengal border, one of the guys who was my assistant 25 years back, he practices in that place. He said, no, you have to do it, you have to do it. I have not seen see the papers. I have to see the patient. I saw the patient, and I have done this type of tumors more than 8, more or less 8, at that huge size. Now, what I want to say, after seeing the reports, seeing the patient, examining it, examining her, what I noticed that it was in the microscopic level, that biopsy report is waiting. That will decide what to do. But the CT report from, I don't know which center it came, I scrutinized, I saw, and it was a beautiful report. It was not in favor of like any bony metastasis. There's no lymph node enlargement. And ultimately, I decided I'll open. Because even let's say if I send it to Tata Center, if I send it to PG Hospital, one of my friends will operate, or a senior surgeon, old surgeon will be operating. Then if he can operate, my dogma is like this. I always think of like this, that if he can operate, why shouldn't I operate? And I've done a video, I'll show you in some off time. But what I want to say, I have audited my past operations before fixing up her operation. So after seeing the report, it is there. Now, one thing, the outcome is that she'll be having an ovarian cyst of malignancy. Now, what I made this thing is that I relieved her. Whatever her days for chemotherapy, radiation, follow-up, but I'm sure because the organs were normal, the policeman of the abdomen, the omentum was normal. I mean, it changes the softness, suppleness of any gut, intestine, or stomach. And I palpated the vertebral column side, any lymph nodes or inguinal lymph nodes, anything. Now, today we have given up fluids by mouth or urine output and everything. So you have to audit your studies. You have to think whatever it is. Forget the exam episode that has finished. Don't just bother that. Go in, because the head and neck and brain finishes, you go for exams within 15 days or 10 days study leave in August, I think, September, whatever it is. Now today is May, June, July, August. You have 4 months. You just distribute your time, which I have been telling you earlier, and you tell me after that you are not progressing. You have already progressed. You are not progressing, I won't use this word. But you have already progressed. You have attended classes, whatever it is. You have to put in a mock test, whatever was done in this is a university exam, and you have known how in groups will be taking exams. And if anyone says amongst you, if anyone says very this thing very good, then definitely he or she will be asked more questions to give her more marks. So I told you target 60%. But if you are an achiever, you want to achieve, you please carry on with your to achieve. Okay. With this, I'm doing a post-mortem. I'm telling you that today will the cervical vertebra. The skeleton is there over here, and the mala, the Jagannath mala, Ram mala, Har Har Mahadev mala. You see, you have learned thoracic vertebra, lumbar vertebra, sacral vertebra, and the coccygeal. Now, what I want to say, the spine is always in the back, the spine, and it will be having the descriptive part. There are 7 cervical vertebra. Now, 7 cervical vertebra. Now, cervical vertebra typical and atypical. 3rd to 6th is typical. 1st, 2nd, 7th. 1st, 2nd, 7th is atypical. Atypical means it's the standard. The typical vertebra has some features, but the atypical has different features. Now, you see the total, this is a schematic, the pedicle of cervical vertebra, intervertebral disc. Now, vertebra, you see, I have told you, I think, that evolution of erect posture. Evolution of erect posture, that means we were quadrupeds. We used to travel like this, like a gorilla. Slowly, we evolved into man. And that posture, we were quadrupeds. Now that the spine is an S. And what I want to stress is that, see your neck, it is thin, your chest and your abdomen, your lower limbs. Now, these muscles are supporting each and every limb or your thorax and performing some functions. Dekho now. Now, what is this? Is that you correlate with the skull, and then the vertebra, the first vertebra, second vertebra, third vertebra, fourth vertebra, fifth vertebra, sixth vertebra, seventh vertebra. And seventh vertebra is now, these is the 3rd to 6th. 1st, 2nd and 7th, atypical. Typical vertebra 3rd to 6th. The 1st and 2nd is the 1st and 2nd has significance, because see, the structure is such, it has to support the skull, and the first cervical vertebra and the second cervical vertebra is, now you see the first cervical vertebra, and these are the transverse processes having the vertebral, the vessel, vertebral artery goes in through the foramina, and see now, this is second vertebra. Now second vertebra is having a, that picture, right. This is the protrusion in the anterior aspect, and it articulates with the atlas. This is the axis. Now it is like this. So একটু লুজ করাতে হবে। যাই হোক, you see it like this. Now these two differences there, and your seventh cervical vertebra. Seventh cervical vertebra, you see you go like this, and the most protruded part, the spine. It is spine-টা protruded আছে। See this, the spine is long. Over here you feel it, feel your seventh cervical vertebra. You will see it is protruded, round. You go on from the scalp and down and feel that there's a small protrusion, because the spine is longer. And then the thoracic vertebra begins. And the now see, this is a schematic. This is the superior vertebral notch, inferior vertebral notch. This is intervertebral disc. This is the body. Okay. Now the triangular is a canal, vertebral canal, a foramen, triangular foramen, vertebral foramen. This is the body. This is the pedicle. This is the spine. This is the lamina. And that is the foramen here. The spinal cord descends. And see, regarding the first, the vertebra and the second vertebra, the dens, the axis. Now, the dens has a first, second, or seventh. Vertebra. Loose behind. Now, what is happening? See, if anyone commits suicide, by hanging herself or himself, so he tries a cord or some wire or whatever it is, even आपका जो चुन्नी है, सलवार की चुन्नी, and sometimes if I want an Apple phone, my mom and dad is not giving, तो चुन्नी लेके बोलते हम मर जाएंगे, हम गला में फांसी फंदा लगाएंगे. What happens actually? If that is one part. Now, if she ties that chunni and puts it in the fan, standing on the tool, and then she kicks it out, and then she hangs it like that. Immediately, she will die, because of this dense fractures, and the vital centers are spinal cord and the brain, midbrain, that comes into the contact. But if I strangulate you, if I take a wire or cord or anything and फांसी लगा दो ऐसे उसका बाद tree में you hang that person, the dense. The second, when you see, you come, second, but the, this part, this portion is fractured. This portion is fractured. It fractures. So when postmortem is done, in a case of hanging, police takes a FIR and whatever it is, name, isko maar dala, so that is one. Postmortem will be, see, that won't get fractured. But in case of hanging by herself or isko फांसी लगा दिया, oh, you see Tamil film and Hindi film and all this, and they hold it, hang it, then এটা না এইগুলো তো সুতোটা পালতে হবে, এত টাইট হয়ে আছে। See, this is, and you see like this. এবার কি হচ্ছে, এটা যেমন ফ্র্যাকচার হয়ে যাচ্ছে। Understood? Okay. You see, this is the your dens, and this is the axis atlas, like this. Here's the skull. So when that it fractures, and then it goes into the your vital centers, medulla and spinal. Immediately there is, when he or she dies. And in postmortem, this is one thing, like, see, this is hey, Baba, this is the, now if, and this is has a facet, this has a facet in the anterior arch, the small oval facets, একবার করে pass down, and that actually, like this, it forms a joint, a small joint. Now if this is, now just see the oval shaped articular surface, and this is the, just see the oval shaped articular surface. Hey, তুমি এত স্যাড কেন? তুমি ক্লাস হয়ে গেলে একটু আমি তোর সঙ্গে কথা বলবো। Now what I want to say is that if you think it's a triangular vertebral, the body, see, it is like this. This is the triangular vertebral foramen. This is foramen, and you, now this is the, now is a time when you are studying cervical vertebra. You compare the thoracic and the lumbar and the sacral, and you will come to know the features. And according to the function, the bodies of the vertebra, when size, the width, the length, anterior posterior diameter of the canal, it goes. And now you see this is the anterior root, this is the posterior root, and this is the foramina transversarium, posterior tubercle, anterior tubercle, and costotransverse bar. This is the bar. In between, you see the, you've seen it. They can know. You take your time. Take your time. See, this is one thing I tell you. When you asked, you pick up the atlas, pick up the axis, pick up the seventh vertebral, atypical vertebra. Don't this thing. You don't get nervous. You know that the atlas is having some features, axis is having some features. The odontoid process of the second vertebra has an articular surface, oval articular surface, and that articulates with the atlas. That forms the atlantoaxial joint. And these are small joints, this will be forming. And in the this is the foramina for your blood vessel. Now, this is the superior facet and that is the inferior facet. All vertebrae having superior and inferior facets. At a common thing. When you ask to lift up a vertebra, then you go and sit starting body, spine, whatever you know, then special features. Okay, you tell me what is the dens. Don't get panicky. And I have told you I have the hanging because you will remember the dens, atlas. Then this has your joto naach hoy, nutile, you all danced in your this thing. So that even one thing I tell you, the head neck is so you are seeing in the Facebook and even of course YouTube the dance. So every body is having its own mechanism to adapt to the function of the whole body. Now it has to articulate with one after the other. Like any and this has to be supported with muscles, ligaments. When you will be dissecting the body, you will be seeing. Plus your atlas or your textbook. See, you go and start drawing every day. Today you just, when you go home, 1 hour, you read typical atypical vertebra. What are the ligaments attached to it? And what is the main, the foramina and the transverse process and the spine, that description. Now the neck. When you are dissecting, prosected specimens are shown, but there will be dead bodies. You can dissect and see the muscles yourself. All the muscles in the neck, you see the sternocleidomastoid and scalenus, you have seen, you read first rib. The scalenus muscles, scalenus anterior, scalenus posterior, scalenus medius, that goes to the neck. From that has to support. And see, there is intervertebral disc. That's a cushion. Now, accordingly, you are driving a car, suddenly that jolt gives you a disc prolapse. And then you will come in the evening in the home, there will be pain, and they say, oh, don't neglect. If you are having any neck pain, and it is not into paracetamol or something, any analgesic, but you do a simple X-ray and see the movements. And also when you are treating a patient, seeing a patient, you tell her to do the neck exercises. After seeing pain, oh, painkiller lik diya, sui lik diya, no. Your duty as a doctor, if you are very busy physician, please you have an assistant. If you are a pain management you studied, but you are not touching the patient, you have to touch the extent of injury. Then you support a collar. If you feel that, just don't take it casual, because the collar costs 200 to 500 rupees. So you can give a cervical collar, and that gives comfort, rest, and then go for your radiological examination. And you will be seeing that the difference between the treatment you have given. Now, every pain, neck pain comes, no, that's why you have to know the anatomy and the judgment you have to make. This is one thing. Second thing is that Now, this is the anterior tubercle, posterior tubercle, and this is the posterior tubercle, tubercle of the costotransverse bar. This is the tubercle of the costotransverse bar, and you can see the muscles, the scalera anterior muscles over here, and scalera anterior, scalera posterior muscles. Now over here, anterior longitudinal ligament. Anterior longitudinal ligament is this intervertebral disc. The longus collis, longus capitis, scleratus medius. This is the ligamentum flavum, interspinous ligament, and the ligamentum nuclei. This is the ligamentum nuclei. If you open a atlas or a very good picture you will be having, if you see, if you now this is the scalp. Okay. This is the khuli, motka. These names we say. Okay. Now these muscles. Now you have to, the muscles I told you there, this is having a different origin. Okay, and it's supported by the ligament. When you see the back from your occipital protuberance from this, you go and see the total spine. If any patient comes to you with the muscular ache, so you make your friends or something, you see, or you see in the atlas, you see in Professor Higgins' website, you go. Professor Higgins is who invented the pioneer plasticization of the human body, plus animal bodies, anything he plasticized. You want to see the neck muscle, the Auckland's 5 videos are there. So head neck নিয়ে নিতে পারো এখন, এটা আসবে না ওটা আসবে না, that is not the question. You don't know what will come and what will not come. So you have a laptop, you take, if you have not taken I told you when you started your class, you take those videos. It will be easy for you. 1 hour you spend sitting in front of that video. The thing, neck muscles, how it is operating, what muscles, it's very beautifully illustrated. Okay? Now, একবার দেখাতো ওই 3-4 স্লাইড। চলো, head neck, brain, hand, then don't panic, because what simple things will be asked. If you cannot answer what are the lobes of the brain and which bone is related to, what is the blood supply of the brain, what is the your venous drainage, and what are the sinuses, all this you have to know, basic, and no one will question you. What is this? You saw, you had the brain in the marked and labeled one part, and the brain in the table, it was given to you. So you have to know, and now see typical cervical joints. These are joints between lower 6 cervical vertebrae. These are similar to other usual intervertebral joints. So they are similar to others. I mean, thoracic and your lumbar, sacral. Yeah. So here nahi. Torsa. Okay, now see, you saw the mala. You have seen the mala. Now see each bone. Now see lumbar vertebral, the lumbar vertebral, thoracic vertebral, they are joints. But you see in cervical vertebra, there's bit, because they are not having great support. So you see it is more or less the anterior surface. ইয়েগুলো কোথায় ওই ইয়েটা ওই দুটো ভার্টিব্রা see the body, see it is overlapping like this. তার কি actually at a if I hit you over here, and just femur bone, then it gets fractured. But over here, if it's a big jolt or big hit, then these things, that has to be supported. That has to be supported. So you can see the overlapping. This feature is not in the other vertebral bodies. মানে একটু see, it is like this with the your now this intervertebral disc is there. A lipping gulo, get it? You can see the lipping and plus the neck muscles. Identification of the main. Now, see articulation between superior and inferior articular processes. The zygophysial joint. Now the articulation between bodies of the vertebra. This is the articulation between the body. Now this is the anterior. This is the posterior, the spine. All the spines. Now articulation between bodies of the vertebra. Intra-articular disc, joints between lateral margins of the vertebral bodies, and secondary cartilaginous joint and joint of Laska. Now joint of Laska can come as a short note or MCQ. Okay, now you see joint between lateral margins of the vertebral bodies. This is known as joints of Laska. Joint of Laska, you know what I'm saying? The joints between lateral margins of the vertebral bodies is joint of Laska. And intra-articular disc is secondary cartilage joint. বাবু একটু ধ্যান দাও, এত বলবো 9 মাস 1 বছর ধরে বলছি। আরে পরে দেখবে, যা দেখবে বই পড়বে, যা করবে বাড়িতে গিয়ে দেখবে। এই যে সকালে প্রিপেয়ার করেছি তবুও আমি এসে আমার নোট বই এসব দেখে আমি ছবিগুলো আঁকছি। তাহলে ইউ ক্যান আন্ডারস্ট্যান্ড, তুমি একবারও না দেখেই পাস করে যাবে কি করে করবে জানি না। কিন্তু যারা থিওরিতে বেরিয়ে গেল, আবার দেখা যাচ্ছে 10 নম্বরের জন্য প্র্যাকটিক্যালে ফেল করে গেল। আমি কিন্তু বারবার এটা বলছি, লাস্ট 4 ব্যাচেস হ্যাভ গন, ইউ আর দ্য 5th ব্যাচ, না 4th ব্যাচ, 4th ব্যাচ। It's all right. Don't think it in that terms. I mean, okay, why I told you about the operation. I need not. I just tell you some whatever 1, 2, 3, 4, 5. I'm telling you about sharing my experiences. How important is anatomy? Plus, you see how many clinical questions have been there. At least short note and whatever it is, that is 4 to 5 clinical orientation. তোমাকে আমি এখন যদি বলি অ্যাটলাস আর অ্যাক্সিস বোনসটা ওই মালা থেকে দেখাতে পারবে? তোমাকে বলছি, দেখাতে পারবে? আমি মালা 3-4টে মালা এনে দিলাম, তুমি জব করছো না, তুমি ভাবছো হর হর মহাদেব তোমার আশীর্বাদ করে দেবে? কেউ করবে না। Now, this is the joint between adjacent lamina and spine and transverse processes, intervertebral syndosmosis. This is the joint between adjacent lamina, spine, and transverse process. This is transverse process. Now, this is known as intervertebral syndosmosis. This the interarticular disc, secondary cartilaginous joint of Laska. Now, joint between lateral margins of the vertebral bodies, joint of Laska. Now, this is the thing I wanted to stress, is that this can be a small MCQ question. It can be a MCQ question. So, be focused, and now these are joints between 6 cervical vertebrae. These are similar to those usual intervertebral joints. The adjacent cervical vertebrae articulate with each other the following: joints between vertebral bodies, joints of Laska, joints between vertebral arches, joints between articular processes, intervertebral syndosmosis, lamina, spine, and transverse, joints between vertebral bodies. These vertebral bodies articulate to two types of joints: articulation between central part of the vertebral bodies, secondary cartilage joint; articulation between the lateral margins of the vertebral bodies, joints of Laska, planes, synovial joint. Next. Now, see, joints of the neck are and their types. Craniovertebral joints, atlanto-occipital joint, it's a ellipsoid synovial type. Median atlanto-axial joint, pivot synovial joint. Lateral atlanto-axial joint, plain synovial joint. See, craniovertebral joint, that means the cranium, your skull articulated with the vertebral neck, the vertebral body, vertebra of the neck. Now, the thing is that, see, craniovertebral joints. Now, if a short note is there, craniovertebral joint, short note, then you have to write the atlanto-occipital joint, ellipsoid synovial. It's ellipsoid synovial type. Median atlanto-axial joint, pivot synovial. Lateral atlanto-axial joints, plain synovial. Now, typical cervical joints between vertebral bodies, secondary cartilaginous joints of Laska, plain synovial joint. Now, between articular processes, plain synovial joint. Between lamina, spines, and transverse processes is syndosmosis fibrous. Syndosmosis is in the pelvis. Syndosmosis between the two pubis. Syndosmosis. Okay, next. Now, this is the classification. Next. Now, see the intervertebral symphysis, secondary cartilage joint. See, this is the lamina, this is spine, this is the ligamentum flavum, vertebral body, this is the nucleus pulposus, intervertebral disc. Now, posterior longitudinal ligament, this is the posterior longitudinal ligament, this is the anterior longitudinal ligament, and you see the ligamentum flavum, interspinous ligament, these are the interspinous ligaments, this is the spine, this is the lamina, this is supraspinous ligament, ligamentum nuchae, and you see a beautiful picture. Now, next. Now, clinical integration, disc prolapse. It commonly involves the disc between C5 and C6 and or C7 vertebra. The herniated disc between C5 and C6 vertebra compresses C7 spinal nerve. I showed you that the spinal nerve relation in the drawing. Now, the spinal nerve Now compresses nerve and causes pain, tingling and numbness on the posterior aspect of the arm, forearm, middle and index fingers. That means you can see it can be in the other way, that now you can see that the disc between C5 and C6 or C7 vertebra, a radiated disc between C5 and C6 vertebra compresses C7 spinal nerve. Okay, and compresses C7 spinal nerve and causes pain, tingling and numbness on the posterior aspect of the arm, forearm, middle and index finger. Now, what I want to stress is that a patient comes with a disc prolapse, now neck pain, and also he or she complains of the pain and tingling of your numbness of the posterior aspect of the arm, forearm and index fingers, this index finger. Now, with this clinical diagnosis, you will be this. Then you go and give a support. You ask, history taking is very important. The what type of neck injury she sustained or he sustained, and accordingly, you see the areas of nerve supply. You have to think in this term. Your old neck, you feel that the ligamentum nuchae, anterior ligament, posterior ligament. Then the nerves are coming and supplying from the neck, it goes and supplying the forearm through brachial plexus. What are the root values of these nerves? এবার তোমরা নিজেরা দেখে নাও, হ্যাঁ, and কত next slide দেখা. Next. Now, this again I am repeating. Clinical integration disc prolapse, it commonly involves the disc between C5, C6 and C7 vertebra. So you can be very specific. If the presentation of the patient with the pain and the numbness and the tingling sensation, you can come onto a diagnosis that this place has a. Now have an X-ray, have an MRI, and then you can see if she needs a operation or only support, and analgesic will do this thing. If there is severe compression, the numbness is increasing, then you have to send it to a neurosurgeon or orthopedics. Both will be involved in the compresses C7 spinal nerve, the compression of the C7 spinal nerve, and causes pain, tingling and numbness of the posterior aspect of the arm, forearm and middle and index finger. Now the middle index finger, posterior part of the forearm, the posterior part of the arm, and this is the C7 spinal nerve. Or they can question you all these features like presentation, that the spinal nerve, which spinal nerve causes pain, tingling and numbness on the posterior aspect of the arm, forearm, middle and index finger. C7 cervical vertebra will be the answer. Okay. Now, cervical spondylosis involves injury, degenerative changes or aging that may result in prolapse of nucleus pulposus. These may affect cervical region often during third or fourth decade of life. The prolapsed disc causes spinal nerve compression, which results in pain, numbness, and burning sensation along the distribution of the compressed nerve. Now, osteophytes, the joints of Lasca are commonly site of osteophytes. Extra-grown bony spurs. What is osteophytes? Extra bony spurs. These may compress cervical spinal nerve. This may also cause compression of vertebral arteries, which are passing through the foramen of transverse area. It may result in vertebrovascular insufficiency and dizziness. Now, if a patient comes like my age or 50s, now আমার জন্য অন্ধকার দেখছি, I'm seeing at a vertigo and also I'm just dizziness. Then you do the x-rays and the thing support, and also see in hypertension even sometimes this your dizziness and things occur. So you have to also focus on that part. Okay. Now, the movement of cervical vertebral column. Now, flexion, bending forward, extension, bending backwards, lateral flexion, bending the neck on one side, rotation, and twisting the neck, turning the chin, and circumduction, combination of all above mentioned movements. দেখবে কিছু কিছু ছেলে এমনি করে দিল, হ্যাঁ, হঠাৎ যাচ্ছে, এমনি করে যাচ্ছে তো ঘাড় ঘুরিয়ে দিল. That's a bad habit. You see, I don't know why. You want to release or relax, I don't know. But it is a bad habit. Okay. Now see, the flexion is that bending forward. Extension, bending backwards. Lateral flexion, bending neck in one side like this. Rotation, twisting the neck. And circumduction, combination of all the above movements. Now, this is one thing. Next. See here. Now, these exercises for neck pain or something with against force. Like when you are asking, you press upwards and the patient is asked to press down like this. Now, that to strengthen the muscles and the thing. And like this. Like this. You have to, you press like this. Okay. And you these are the movements you have to ask the patient to perform. You are a very busy practitioner. Okay. But take your time. Because you see, I have seen prescription, I have seen complaint from the patient that কোথায় গেছিলে মাসিমা কোথায় গেছিলে we are treating for 40 years. বললো না ও বললো ব্যথার ডাক্তার এসছে বাতের ডাক্তার এসছে. When the doctors come who relieves pain of arthritis and all this, but he did not touch the patient. You are a pain management person. You have to see where is the clue you have to get. You write your you can you ask your chat GPT and all this neck pain, numerous drugs. No exercise, no touching the patient. That's why you see two photographs. one on the right and the left. Hippocrates is one side and Sushrut is one side. You see, they are feeling for the patient. You see, palpating, Hippocrates is palpating the liver. If you study that picture, you will know that the mother is, her facial expression is that my son will be okay because he is in the safe hands. So only if you just say, if you touch, it gives a big impact. You just tell, okay, এরকম করে দেখিয়ে দিলে 5 মিনিটের ব্যাপার। আমি চেম্বার করতে করতে I do it myself because I don't have 70 patients or 100 patients. I have a very small practice. But when you go to an institute, you have an institute, then you have different departments. You have physiotherapists and all this, dietitian. So you have to accordingly send the patient to the physiotherapist. And if you are in a medical college, you are a professor, then your students will demonstrate. Because medicine only counts 10% to 20%. The rest is all diet and exercise or fluid intake, all this. And see the movements now. The next. Now, this is the intervertebral nucleus pulposus, annulus pulposus, lamella. This is common. You have seen read in thoracic vertebra, lumbar vertebra. Next, intervertebral disc. 8 changes of blood supply. Next, you have to read. Now, this can be a short question. What is the intervertebral disc? And you can just draw like this and finish off. Next. Now, one thing I tell you, if you see critical herniation of the disc, it is a protrusion of the nucleus pulposus from damaged or ruptured annulus fibrosis. It may cause pain, numbness, or paralysis. Degenerative disc disease with advancing age, intervertebral disc may show degenerative changes. These changes cause reduced elasticity and shock annulus ring in Latin. Next. Now, cardiovertebral, see these two joints. When you read the skull, then you will see the atlanto-occipital joint and atlanto-axial joint.